Thank you, Mr. Speaker. Mr. Speaker, I rise to share with the House a headline which was reported in yesterday's Connecticut media, which I believe is going to reverberate all across the country. It reads that as federal health reforms take effect, Aetna proposes rate cuts. Now, for employers who have been seeing double-digit increases for the last decade, to see a headline that says health insurance premiums are going to be cut probably seems like it must be a typo, or there must be some April Fool's headline joke. But the fact of the matter is as the story indicates, because of the federal health care reform law, the new premiums, which are going to go into effect in September, that Aetna is proposing, have to be reduced from anywhere from 5 to 19%. For policy holders, the savings with these new premium announcements will be up to $3,500 a year on policies that cost about $14,000 today. Why is this happening? It's because the health care reform law contains a provision which says that insurers must demonstrate that up to 80 to 85% of premium dollars have to be spent on health care. It is called the medical loss ratio rule. And under existing premiums that Aetna is collecting these days, only 54% of premium dollars are presently being paid on health care. Now, again, as someone who was a small employer before I came to Congress in 2007 and paid those double-digit increases year in and year out, what we're seeing now is the fact that there is transparency in terms of how premiums are being handled, and that people are now understanding, and in fact regulators are enforcing a rule which says that when you pay health insurance premiums, the bulk of it, not all of it, but the bulk of it actually has to be spent on health care. And because of this rule, the medical loss ratio rule, we saw yesterday that Aetna is proposing to cut health insurance premiums for employers, and this is going to be replicated all across the country over the upcoming year as the Department of Health and Human Services are issuing these rules to state insurance departments for implementation. Thank goodness for those employers who are now going to be seeing real rate relief that we did not repeal the health care reform law. Thank goodness for those employers who are getting small business tax credits back in the mail today for their IRS filings that they submitted this year, that we did not repeal the health care reform law. Thank goodness for all the employers across America who are now participating in the early retiree health insurance program, which over half the Fortune 500 companies in America have signed up for as a way of moderating early retiree health insurance costs, so that they can encourage employees 55 and up to take retirement, opening up opportunities for younger workers in this country, which we desperately need, looking at graduating classes that are facing daunting employment prospects. The fact of the matter is the health care reform law, in terms of small business tax credits, real rate cut relief, early retiree programs that help employment-based health benefits, is now rippling through the system and providing help for thousands and thousands of employers all across this country. We know now that the health care reform law is helping almost 1 million young Americans between the ages of 21 and 26 stay on their parents' health insurance plan. I was with a student up at the University of Connecticut the other day. His sister was months away from graduating at NYU when she was diagnosed with a rare nerve disorder, and thank goodness for the health care reform law that she was able to stay on her parents' health care plan, and now she's receiving life-saving treatments that is going to allow her to attend law school starting next year. For seniors, we are seeing the new Medicare provisions that will close the donut hole, that will provide preventive services like annual checkups, cancer screenings that are now covered 100% by the Medicare program as a direct result of the health care reform law. These benefits are now flowing through the system with a bill that was fiscally responsible and that CBO scored as a net saver to America's budget deficit. Again, I want to make sure people see this headline, that employer-based premiums are going down because of the health care reform law provisions that will protect employers and individuals who buy health insurance, so that their premium dollar is actually going to be spent on health care and not on excessive administrative costs and bonuses for people in the insurance industry. Again, I come from Connecticut. We're proud of the insurance industry. My dad worked as an insurance company lawyer for his whole lifetime, sent me to college because of that. The fact of the matter is these rules are something that the insurance industry can coexist with. They can make a healthy profit. They can grow their business, but it will stabilize the market so that people are not going to be forced to abandon coverage for their workers and for themselves because of the skyrocketing double-digit increases that we've been experiencing as a nation for far too long. We have relief in sight, and this headline verifies that. And let's preserve these protections and make sure that our employers and individuals have access to affordable health care. I yield back the balance of my time.